Today we'll be talking about the socio-ecological model in population health and how it applies to the childhood obesity pandemic. This presentation will discuss the socio-ecological framework, but before we can discuss the aspects of this model, we must first discuss the evolution of the model. First, we have the precede-proceed framework, which was used to identify the social aspects that connected to the health problems and their disparities. Then, the ecological model used these key elements of the precede-proceed model, but incorporated more of an ecological lens to involve environmental factors. Then, finally, the socio-economic model was developed by incorporating both the precede-proceed model and ecological models, building off of their strengths while using a more inclusive, dynamic approach as opposed to a linear approach as seen in the preceding models. The key characteristics of the socio-ecological model are that it is inclusive of multiple factors that may transpire in the social, environmental, personal, and political worlds. As you can see, there's 5 layers to the model, and they all have their own distinguishing features. However, they're also all connected, which is a key aspect of this model. The first, most inner circle is interpersonal factors, and so some things that would go here would be individual characteristics such as knowledge, attitudes, behaviors, self-concepts, skills, and so on. And then the next bubble out is interpersonal factors, which is formal and informal social networks and support systems, so branching out to friends and families and things like that. Next, we have the institutional factors, which is more the social institutions with organizational characteristics and formal and informal rules and regulations for operation. Next, we have the community factors, which is the relationships among organizations, institutions, and informal networks within defined boundaries. And finally, the last circle is public policy level factors, which deals with more laws and policies. So this model uses a socio-ecological perspective that uses an environmental justice lens and helps us to reject environmental determinism and embrace the ways in which an individual interacts with not only themselves and others around them, but also their environment, and how this influences health behaviors and health outcomes. There are 4 assumptions that govern this framework. Number 1 explains that this is a multidimensional and complex framework that focuses on physical and social dimensions, which is what really separated it from the previous 2 frameworks. Number 2 illustrates that there is a multitude of factors coming from the environment that can alter health outcomes. So this assumption was really derived from the ecological model. Number 3 explains that health outcomes are influenced by a number of factors at a number of different levels, as seen in the multi-dimension fashion of the diagram. So having those multiple bubbles to identify the multiple steps that are individual, however, that do work together. Number 4 demonstrates that humans are not only affected by the environment that we live in, but the environment is also affected by us. So there's that sense of reciprocity there. Just some concluding remarks considering the framework. So the framework was built using the strengths of the precede-proceed model and the ecological model while addressing their respective weaknesses to build a more comprehensive framework. The socio-ecological model allows us to understand how inequality is transpired in real-world situations and how health promotion can disrupt the cycle of inequality. The main goal of the framework is to take a multidimensional approach by including individual, interpersonal, community, organizational, and political dimensions to get a more comprehensive and holistic view of health disparities around the world. The following article highlights the complexity of this model by applying all dimensions to the obesity pandemic in the modern era.
Ori Vachespati and Associates utilized the multiple layers of the social ecological model to better understand the etiology of childhood obesity and to formulate a framework for prevention. It was important for the researchers to use this model to predict influences of childhood obesity because studies often investigate the independent contribution of one or more elements of the built environment, but seldom quantify the combined contribution of various elements of the built environment together on children's weight status. This study conducted random telephone interviews among households with children in racially diverse, low-income neighborhoods. They altered the social ecological model to fit their design as reflected on the slide. They adapted the framework to focus on the following levels: child weight, child characteristics, parent characteristics, household characteristics, neighborhood characteristics, parents' perceptions of neighborhood food and physical activity environments, and objectively measured presence of food and physical activity facilities. It was crucial for the researchers to apply this model to the data they collected in these interviews to effectively consider the issues that are highly correlated together that would usually be observed as individual factors in other studies using similar frameworks. Orivachasbadi and associates were able to find that the social ecological model can contribute significantly to understanding, predicting, and hopefully preventing childhood overweight and obesity. As we previously mentioned, the social ecological model focuses on the individual at the smallest level. Orivachasbadi and associates considered the selected children's weight and personal characteristics at this level. These characteristics include things like race, age, and gender, which are often associated with a child's weight in research. Children's individual characteristics were considered to be significant predictors of obesity status when considered in combination with other variables investigated in this model. When considering the interpersonal level of the social ecological model, Orivachasbadi and associates maintained focus on both parental characteristics and household characteristics. Data collected surrounding parent demographics studied the BMI and birthplace of each parent, as well as the education level of both parents, with particular focus on the mother. Parent characteristics were identified to have the greatest contribution to children's weight status among all of the factors that were studied. The interpersonal level also greatly focused on household characteristics. The household characteristics that were studied in this context were household income in comparison to the federal poverty line, food security, access to a reliable vehicle for grocery shopping, the language most often spoken at home, and any participation in federal assistance programs. These characteristics allowed the researchers to examine the interpersonal level of the social ecological model and better understand the contributions to predicting these children's weight status. Next, in the social ecological model, there is consideration of factors at the organizational or institutional level. In terms of childhood obesity, Orivachasbadi and associates focused on the demographic characteristics of the children's neighborhoods, as well as objectively measured geospatial features within these neighborhoods. This study focuses on characteristics like the average income within the neighborhood, as well as the most prevalent race of residents of these neighborhoods. There was also great focus on the proximity of access to adequate food sources in areas for physical activity. This study objectively measured ease of access to grocery stores, adequate amounts of reasonably priced, fresh and healthy foods in these stores, and proximity to parks or other safe areas for physical activity. Orivachasbadi and associates determined that these organizational factors contribute significantly to predicting children's weight status and are extremely important to consider in developing childhood obesity prevention strategies. In considering the community level of the social ecological model, the researchers emphasized the importance of parental perceptions of their neighborhood in relation to childhood weight status. In this study, it was found that these parental perceptions had the strongest association in predicting children's weight status, especially when considered in conjunction with other parental characteristics. The parental perceptions that were considered in this study include physical activity opportunities in the neighborhood, the overall safety of the neighborhood in terms of traffic and crime, how pleasant parents perceive the neighborhood to be, the condition of public spaces and sidewalks, and parent perceptions of access to quality and affordable food. It was determined that parents' beliefs about their neighborhoods were a strong predictor of childhood overweight and obesity. By studying the community level, and particularly parents' perceptions, the researchers were able to determine that positive perspectives on the neighborhood and accessibility within these neighborhoods were extremely important factors in determining the health of children. These perceptive components may have otherwise been ignored to simply consider physical proximity when observing childhood obesity in a model that does not observe the correlation and interactions between multiple different levels or factors of a framework. The final characteristic considered in the social ecological model is public policy. Orivachasbadi and associates specifically utilize this framework in order to describe and understand the possible etiology of the childhood obesity epidemic as a way of laying the groundwork for future interventions and policies. Their analysis concluded that the social ecological model is a viable framework to effectively investigate factors on a variety of levels that are each independently associated with children's weight outcomes. Each of the layers of the framework that were considered in this study were identified to contribute significantly to predicting children's weight status. Through the use of the social ecological model, the researchers were able to conclude that a successful childhood obesity prevention strategy would need to focus on improving the built environment in which children are raised, as well as maintaining focus on engaging the parents in promoting and maintaining these improvements. By observing each of the levels of the social ecological model, their effects on childhood weight status, there is an opportunity for future researchers and policymakers to observe these identified factors and utilize them for the development of future effective interventions in the context of childhood overweight and obesity. Furthermore, by using this framework, they were not only able to see that people who share one characteristic suffer more from the obesity epidemic, but they were also able to categorize people according to multiple characteristics to see who is most at risk. This phenomenon, when multiple characteristics are attributed to increased risk of a health problem, is called intersectionality theory.